so much for the welcome and the introduction. It's also an honor for me to be here today, and Josh and I have worked together for a long time. We've done trainings or speeches, whatever we want to call this together, and so I feel honored to be here as well with Josh. I'm going to provide more of like the nuts and bolts kind of about the crisis team, and then I'm going to have Josh provide all the wonderful narrative, anecdotal, awesome work that he does as well. So the Deschutes County Behavioral Health has had a crisis team for over 20 years. We started out as a team of 3 or 4. We used to work out of the Courtney building, which is over on the east side of town behind the hospital. And we would do a combination of meeting people in a crisis walk-in situation who would come in seeking help. We had a mobile crisis team that would respond 24/7, 365, Lapine, Sisters, Bend, Redmond. We've been doing that work for a long time. We moved to the Stabilization Center 3 years ago, which is on the campus where the Sheriff's Department is, off of Empire, the north part of town. And at that time, we opened up a cutting edge facility for Oregon, for the nation, if I could be so bold to say for the world, where we provided an opportunity for people who are experiencing a crisis, however they define it, to have access 24/7, 365 to a therapist. What is great about the Stabilization Center, and I will talk about numbers, is that people found us quickly. People come in, we got to work really quick. In May of this year, I have to say we're in 2024 now. It's gonna take my brain a little bit. In May of 2023, we started a new program similar to our mobile crisis team that we had had for about 20 years called the Community Crisis Response Team, which gave us an opportunity to respond to mental health crisis calls without law enforcement. Before May, and Josh can speak more to this, before May, anytime we had a call to a person's home, to a person in the community, we would go with law enforcement. Law enforcement would call us. Starting in May, through the support of our local 911 and dispatch and our law enforcement partners, including Sun River, Black Butte, Bend PD, Redmond PD, Oregon State Police, Sheriff's Department, we developed a program where when people are in crisis, again, however they define that crisis, they can call the non-emergency line. The dispatch connects us to it through either a phone call to us, or we're connected to the internal CAD system, which is computer automated dispatch. Yes, I remembered it. So for the last 6 months, we have been providing response when it's safe. We still do bring law enforcement with us if we need them to keep us, our client, and the community safe. I want to be clear about that. We have a relationship, we have a partnership with all of our law enforcement partners. They will be there if we need them, okay? I want to give just a couple of, I think, really remarkable data points. I'm going to jump a little bit to the Stabilization Center. When we opened in June of 2020, up until December 31st of 2023, which was just a week ago, we had over 12,000 visits in that period of time. 17% of those visits were brought by our law enforcement partners. What that means is our law enforcement partners were in the community meeting with people, and they're like, this seems like mental health or crisis or something, I'm not sure. I'm gonna bring them to the Stabilization Center for them to meet with a therapist.
And mind you, that's Deschutes County Sheriff's Office,
Yep.
Bend PD, Redmond, Black Butte.
Sun
That
River.
is Sun River.
Mhm.
Crook County, I've seen drop people off like
Yeah.
a couple times just
Yeah.
because they didn't have it. So mind you, that is a gigantic fingerprint.
Yeah, huge. And so when law enforcement drops off people, it diverts those people who historically would have been taken to the emergency department, where they may or may not have been seen. It also prevents them from historically going into the criminal justice system. When people are brought to the stabilization center, we have the ability to determine if they need to go to the emergency department, we can get them there. If after they meet with us, we find out that they have a warrant or something going on and they need to go to the jail, we can also do that. But the Stabilization Center has provided over 12,000 opportunities for people to be diverted from the emergency department or for the criminal justice system. Now, if I turn to CCRT, the Community Crisis Response Team's specific details, which again has only been operating for 6 months, we have received a total number of calls, 1,491. Of those total calls, 417 were met face-to-face and resolved. 72% of them were resolved over the phone. 28% were resolved face-to-face. 86, I'm not a math person, but it sounds pretty good to me. 86% of those calls we resolved without getting law enforcement involved. 86%. So really darn close to 90%. I'm super proud of those numbers. I'm super proud of the staff who've been able to provide that service. So at this point, yes.
I'm just curious if you're federally funded, is it just county, is it state, is it combination?
Great question. A combination. We have the SAMHSA grant, Substance Abuse Mental Health Association. I apologize, I'm not a grant writer. Federal grant funding from the federal government. We have City of Bend funds. We have Deschutes County Sheriff's funds. We have OHA, Oregon Health Authority funds. We received, I believe, 400,000 roughly about a year ago. So it's across the board combination of funding. City of Bend and Deschutes County Sheriffs in particular was instrumental in helping us start the Stabilization Center 3 years ago. It was a partnership between those entities. Yeah, thank you for asking, great question. Okay, I'm going to have Josh take the stage.
And thank you so much. I'm gonna start having you introduce me wherever I go. Yeah, that was beautiful. I don't know where you got that. Was so nice. I was like over here getting all teary-eyed. And just something about Rebecca, like she's been doing this work in this community and in the state of Oregon for decades. Like she is the best type of human being and social worker. I just didn't want to like let that go unseen. And she's so graceful and helps us divas that call ourselves therapists every day. Because you want to talk about a needy group, you get a bunch of therapists together. And I was in the military for a bunch of years, so I can say the military, we're very needy too. The therapists, we're right there beside them. Like it's such a needy group. My name is Joshua Gage. I'm honored to be a therapist, and this is my hometown. I was born in St. Charles, and we were talking earlier about how I used to ride out here for dirt bikes. So this means a ton to me, just to be honored to come home and work here and be part of the mental health future that we work so hard at. So the stabilization, actually first we'll start with CCRT, because when we started this model, there was a lot of public caution. And because I'm a diva, I would get on and read people's comments on like, what is it, Nextdoor? You know, all these groups that you gotta get on. I know you shouldn't read it, but you can't help it. You know what I mean? You get in there, you're like, all right, I'm not gonna read it. 5 minutes later, why would they say that? Who is this person? Dislike their Facebook post. You know what I mean? Like, cause I would really do that. It's not on my account, I use my wife's. We saw that there was some great caution, which I really appreciate, because we have these humans that I'm lucky enough to call coworkers, where we're gonna be responding without law enforcement. So first of all, making sure that they felt the capability and the understanding of what we were doing here and how significant it is that we're doing it here in this county. So with this, we got great training from the sheriff's office, and there's a couple of us that have prior law enforcement experience and military experience that were able to kind of help these clinicians feel more aware about what was going on around them, and we will continue to develop training to get people this help. But going out there and meeting with people without law enforcement immediately since day one was such a big change. Because let's face it, who here is able to act the same way when they're driving with law enforcement behind them? Not one of us. Not one of us. And I know I'm not doing anything wrong. And every time I get a cop behind me, I'm like, oh man, they're there. Here we go. So can you imagine having your roughest day, finding out your spouse cheated on you, finding out that something's going on with your kid at school, finding out maybe things just aren't making sense, right? Psychosis comes on for many of us, and those of us that have it in our family have seen it happen. So if law enforcement's there, you immediately have a trust issue of can I share here? Can I talk about these thoughts that are happening? And we all have that, you know what I mean? It doesn't discriminate for race, for gender, for socioeconomic. We all go through crises, and if law enforcement's there, we may not be as trusting to talk to somebody. So when we go, and me looking like I do, I always try to take somebody with me. You know what I mean? Because I look like this. And locally I work with some amazing clinicians and case managers, where if I see somebody, and because face it, if you and I are just hanging out, and I come out here like this, I don't know about this guy. I wouldn't trust me either looking like this. But if I have somebody with me, hey, do you feel better with this person? And you're like, yeah, I do, absolutely. Because we're gonna get you the help that you deserve. If somebody doesn't feel safe with me, we have an entire team to pull from to make sure that everybody in our community has somebody that they can speak with and feel safe with. That is one of the great things about responding without law enforcement. We can keep them to deal with the calls that they need to respond to. This 12,000 contacts doesn't just represent people, it represents hours, taxable hours, right? And the hours that go in for follow-up for law enforcement, or for EMTs, or for the teams that have to get involved, when we can streamline that and get them into resources like detox, or like long-term mental health services. So there's so much benefit to it that's so beautiful. Sorry, I'm going off on a tangent.
You're doing great.
I appreciate you.
You're doing great.
You two right here. Me traveling, you two. So, I was told you guys are gonna have a bunch of questions. I'm all about being wide open, so as you guys get questions, please feel free to ask. Cool? Okay, so another thing about CCRT and working with law enforcement.
What is CCRT again?
Community Crisis Response Team.
Thank you.
So a couple acronyms, if I say the STAB Center, which I try not to say anymore, it's the Stabilization Center. STAB Center just doesn't have the same ring to it. The t-shirts weren't selling like we thought they would. So there's the Stabilization Center, there's DCBH, Deschutes County Behavioral Health, which is kind of the umbrella. And then also, I think that's it for now. And if I say any of them other, I'll do my best. So the good thing about the way that we work right now is that we respond together, but law enforcement knows that they have something, they can call so that we can get eyes on. And I love stories, I love examples. So an example of this was when I was in grad school, and this amazing supervisor we have, her name's Haley, remarkable human being, been doing crisis response forever. She's like this big, and she's one of those super smart, tiny little dynamite packages. So she comes out, and I'm a grad student, she's like, hey, I'm gonna go on to MCAT ride along. And I was volunteering at the Stabilization Center to see if I liked it. She's like, you wanna come with me? It'll be quick call. She knew exactly what she was doing, very predatory. And I'm like, and she was like, come with me, I'm gonna take you to this call real quick. So we go to this call, can't give out information, but this person is highly successful, PhD, highly successful. This person out of nowhere's second DUI in 3 days, talking gibberish, but if you listen to it, there's these heavy terms in this, what somebody would say is bad. And the officer's like, amazing officer, name's Josh Spano, sheriff's officer with the sheriff's officers. I will still praise the students until I lose my mind, because just how great he did. So he recognized this behavior and was like, hey, someone needs to get out here and talk to this person. She gets me over there, we're talking to this person, and they're like, there's something bigger going on here. Listen to the terms. And this amazing clinician starts writing out these terms. Like, oh man, I was talking to somebody on the phone, and they weren't helping me, and then they yelled at me, and I don't know why, and I was like, yeah, that doesn't make sense. This person has a PhD, they're saying these heavy terms, and then they start saying heavier terms. And you're like, oh, okay, yeah, there's something going on. Now, to most of us, we're just like, they're speaking gibberish, not making eye contact, Like obviously they haven't showered, they've been drinking. We start looking at these very things where we could judge pretty easy. But this clinician was like, no, there's something bigger going on here. We take this person to the hospital. They recognize that they just needed like one-on-one, like attunement time, sitting there talking, letting him know everything's gonna be all right. And I'm like, hey, I'm gonna wait outside. He's like, no, come watch this. I'm like, all right. Go in there, and this amazing clinician made this person feel like they were the only person in the universe. And it was the most beautiful thing that I've ever seen. And after about 20 minutes, she's like, hey, let's step out. She's like, one of the saddest things is the way that people look at women that face hard traumas, because women work so hard, and when something bad happens to us, it feels like most of our lives they don't listen. So you really want to give them the opportunity to listen and give them the space. This person was sexually assaulted by a colleague, and they just broke, because who's expecting that to happen? And they absolutely had me hook and line and sinker, because it saved this person's license, saved them 2 DUIs, and got them into the resources, and was able to get this person to where now they're practicing again, fully functioning, and the people that did the horrible things to them were held accountable. It was just a beautiful thing, but I still get choked up about, because we need more supports like that aren't judgmental, that are willing to meet us where we are, and they're willing to help us regardless of what that means, right? And it doesn't matter if you're on the west side or sleeping next to the parkway. If you're under that, what I always like to use, if you're under that wave of trauma, you still can't breathe, and we still need somebody to lend us a hand. So I love what we do, and I'm very blessed.
Do you serve youth?
We serve everybody from 8 years old, 6 years old I've had, to 90. It's one of the few jobs, much like a first responder when I was responding to 911 calls, or an EMT, you have no idea. You have to be kind of a jack of all trades, just because like when we get a 911 call, we don't discriminate. We 100% find out if it's safe, so that way when we get people on the way, we can make sure that the environment, because we're so, as I said, we're divas, so when we show up with law enforcement before, we're just able to waltz on, be like, thank you gentlemen, thank you. But now we're like, oh dang, they're not here. We gotta make sure it's safe what we're getting into. So there's been some growth in that, but for the most part, like, yeah, we love responding.
Yeah, and I just want to provide some quick
Yes.
data follow-up. The youngest we've served is 5. The oldest we've served, I believe, is 96. So we can see anybody on the lifespan. The only service that we provide that we can't provide to youth is at the Stabilization Center. We have a respite unit, which is 5 recliners where people can come 18 and older. They can come and get some rest, if they need some food, if they need to take a shower, if they want to meet with a therapist, connect with a case manager, connect with one of our peer support specialists. Peer support specialists are people that we have at the county who bring their lived life experience to their work. They're phenomenal. We could not operate or be successful without them. So people who access our respite unit and come and rest with us for hours, we are only licensed for 18 and older. So if a youth comes in who is needing that kind of level of care, we would have to unfortunately get them to the emergency department, which is the only place where you can go currently in Central Oregon to get a referral for a higher level of care for inpatient psychiatric hospitalization. We also work closely with a program that used to be formerly known as Youth Villages that maybe some of you have heard of. They are a 24/7 mobile response team basically that specializes in working with youth. We can also make direct referrals to that program where they wrap around the individual and families for roughly 2 to 3 weeks and do in-home, one-on-one, in-home family work. They get them set up if they need medication. So we do have ways of supporting youth if they need that higher level of care. A youth or a child is also welcome to come in to the Stabilization Center to speak individually with a therapist as well. Did I get it more complicated, or is that, okay.
A follow-up to that, do you have to have parental permission?
Do you want to answer that, or do you
Go
want me to? So in the state of Oregon, 14 and older, you can be there, you can sign off on your own. However, we believe if a youth comes into us and they're 15 and they are in a crisis that they need support, they're in immediate danger, we need to keep them safe, we will reach out to the family. If the family is not involved in their life, that's a whole different ball of wax, but we work our best to incorporate families, especially if we need to do safety planning. However, 14 and older can show up to the stabilization center without parental consent. 14 and younger, if they show up, we have got to have the parent or the guardian involved. Clear as mud.
Tagging on to your statement, you said these youth under 18 would either go to the hospital or the youth what?
It used to be known as youth villages, and it's MRSS now, which is, I'm sorry, there's so many acronyms.
Okay,
Mobile Rapid something.
I'll just put MRSS.
My
and look it
apologies.
up. Thank you.
Yeah, thank you for following up, because I
Yeah.
didn't provide what they are currently known as, thank you.
Yeah, no problem.
They used to be known as CATS.
Cats and youth
Yeah,
villages.
and they are, like what Rebecca said, they're a service that we refer to because they are highly, they are going into the youth's house. They are like 100% hands-on. It's a great program for kids that are going through a really hard time in their lives. But yeah, I guess I should go to the stabilization center. So somebody comes in, like, just to give you guys an idea for the stabilization center first. Somebody goes in there and they don't even have to give their name. Because sometimes people are like, hey, I definitely need to speak with somebody, but I've had issues with like trusting mental health professionals, or I've had issues with anything. So we're like, cool, yeah, don't sign anything. Oh, Jane Doe, that's good. Like, can I get you some mac and cheese? Because like we got mac and cheese, cup of noodles, tea, all that other stuff. And sometimes, well, people's nervous systems are so deregulated that you start talking and you're like, I need some food. I don't know when the last time I ate. And you're like, same, bro. It's like you need mac and cheese. I need mac and cheese. Let's do this dance. I'm not gonna leave to eat carbs alone. And so like sometimes like having that shared attunement of just like being able to like know like, okay, good. I can relax here. I can be safe. So then what we do is we take you back. We have 3 or 4 rooms that we can see you in. Super private, but there is cameras through the whole facility, but not inside of the rooms that we speak in. And then if it's deemed necessary, then we find the resources for you to go to. Now, what resources those are? We have Brooks Respite. Brooks is in Redmond, so that can be anywhere from like 2 to 6, even 7 days, which I've seen. And that's a place where people can go if they really just need like a structured place to sleep, that they're going through a crisis, whether it be like a big medication change, or whether it be like something goes on at home and they just need a couple days, and that's for 18 and above. We also have some places outside the area, like there's this one, Cedar Hills in Portland. I love that place. They're inpatient. They have a floor of their facility straight for veterans, and they do everything from art therapy. They do a dual diagnosis approach where they treat the trauma and the addiction at the same time, which I love. And then we have a couple other places throughout the state of Oregon that we can refer to for those next level of care. And then the hospital if needed, because they have stage view and PES, but that's for that really high acuity and that type of crisis where they're not able to either like make sure their safety is good, the safety of others, or if we just see that they're just too much of a danger right now. Yes, ma'am.
Is it known to the immigrant community? Do you take immigrants?
Yes, absolutely. So we have an in-house board that we use that we can log on, and then we find different interpreting services that we can do. We've all had to use it a couple times. And then we have an in-house Spanish speaker during the day. But yeah, we try to see anybody that we can. We don't turn anybody away. Thank you, great question.
Yeah, you don't need insurance.
Yeah.
There's no payment. Nobody ever gets a bill for accessing crisis services. So we really truly can see whoever walks in the door. Yeah.
I'm sorry, this young lady was.
So I just have a couple of technical questions. So you talk about someone's in trouble and they they're calling 911, and then what happens?
So if they call 911, then the dispatcher immediately begins their procedures of troubleshooting to see if this is a law enforcement call, a medical emergency call, or a mental health emergency call.
Okay.
They put it in this, the CAD system, which we all have access to, they tag the needed services in there, and then we start working with these community partners about appropriate response.
Okay.
If we're like, hey, we'll handle it, us and law enforcement, I think EMTs for law, we really rely on cell phones. Cause there's sometimes where you can reach out, like we didn't have that ability before, and start troubleshooting with the person that you're responding to. Cause many times they'll be like, hey, I'm having the hardest day, like it's anniversary of mom's death and all this other stuff, and be like, awesome, do you need to get out of that environment and come somewhere safe? For the most part, we get yes, awesome, come to the stabilization center, let us give you somewhere safe. Like, I mean, it's like one of those places where it's like Rules of Fight Club. I don't know if you guys know that movie, it's an older movie. No information gets out. Like, we see everybody in this place, it doesn't matter who you are. Like, we see everybody from law enforcement to murderers, we see everything. It's true, it's true. We see like the whole, I mean, that's the biggest spectrum we can do. From 90 something to 5 years old, no information gets out because we take our honor so seriously. To where like it doesn't matter who you are, what language you speak, we will make sure that you get the help that you need. Yes?
So to follow on, from the time that someone calls 911 till the time that it's determined that they're gonna get your help, approximately how long does that usually take?
The troubles, once we're tagged in it, the troubleshooting immediately begins. So it also depends on the call, because like, let's say that it's a call where somebody's wanting to, I mean, it's such a, like to have the black and white is something I wish we
I'm
had.
not talking about when they come to the person, but how long does it take for it, generally, from the time I call 911 and it's determined that I'm.
Should be minutes. Should,
Minutes.
if that, like, it's, once the dispatcher starts entering it into the CAD, we have somebody always on the CAD that starts troubleshooting it and working with law enforcement EMTs to see who takes the call and who's gonna reach out first. Now, also, we're very new at this program. It has only started since May. So we have very often, like we had one time where we had 4 calls going on simultaneously. We had our director, Adam, at one call who had to go. Guess how much paperwork he had? We had somebody run him his paperwork. Being the director is a heavy crown to wear. Like, I feel so bad for that dude, because he's like, yeah, I'll go, and then he gets there, he's like, oh, this is a big one. Like, awesome, he stepped up. But we also had, I think you at one call, at that exact same time, another supervisor at a call, and then a clinician at a call. Because with crisis, we have a saying, it's either crickets or chaos. And so there is like a prioritization that has to go on, much like law enforcement has, where we have to take, like if someone's in active psychosis, running nude down the street, we have to get to that call. But if someone has a weapon threatening people, that takes precedence, but we can get law enforcement there to secure the scene. But we take care of the other one and get them a rope.
Thank you.
Yes, ma'am. Sorry, I don't know who was next, I apologize.
I know that there's a dearth of psychiatrists and clinicians United States wide.
Did you say dirt?
Dearth.
I
think
love
dearth.
that word. I would never play you at Scrabble. Sorry, keep going. I love that. So keep going, ma'am.
Thank you. I'm wondering though, how it is here, if you have enough resources to push somebody along to find a psychiatrist or a clinician outside of your area. I mean,
We
outside
never
of-
have enough resources, I'm always
Yeah.
gonna say.
Is it
We
really
always
hard,
need.
or is it, or do they seem, people keep coming back to you because they can't find anybody else?
So
kind of thing?
luckily what we have, and great question, I appreciate, you a mental health
No.
professional? Oh, that's a great question. We never have enough resources, so if anybody wants research into grad school about going back, let me know. I'm always pushing people, especially strong women, to become clinicians. Locally, what we try to do is if they're in acute, like if they're in acute crisis or there's something big going on, we will get them an access appointment with Deschutes County Behavioral Health as quick as we can, which is sometimes a week, sometimes 2 weeks. And we encourage them to come back to the stabilization center until they get into that. Because if they are able to screen in to Deschutes County Behavioral Health Services, they get a case manager, peer support services, they get help with finding work through supported employment services, they get help sometimes with finding housing, because Deschutes County Behavioral Health does so much with the limited resources we have. I mean, we have teams that are dedicated to like any type of research that shows that it helps people in the long term. Now, if they don't screen to that high of need to get them into our services, what we often do is go to like websites like Psychology Today. A bunch of us work with local partnerships, like because like we'll meet like a group of nurse practitioners that all meet together. We'll be like, sweet, we have a group of 7. Let's throw like if we help as much as we can because we're both social workers.
Yeah.
And so we're really big into the need of better systems. And so it's something that we're always reaching out. Like if anybody has any openings for that's a clinician, let us know. But the need is really high around here, and it is sometimes very difficult to find people.
And unfortunately, as you can all imagine, a lot of it also depends on your insurance.
Yeah.
Which I hate to say, but it's the truth, it's the reality. So there are some providers here who do take Providence insurance, some who don't, some who take Blue Cross Blue Shield, some who don't. But I would say we are very limited and we need more, absolutely more resources. One thing though that has been beneficial about telehealth is I have learned more and more. I'm hearing a lot of anecdotal stories, people who are having a hard time getting maybe in person are going to other states and getting telehealth, which is creative, and they're okay with that. I think as long as a person's okay with receiving that kind of help. I do worry people who need the more in-person support that we're just losing. They're gonna fall through the cracks,
So
unfortunately.
you can't do telehealth here in Oregon, or?
Oh,
is that-
we can, it's just what I'm saying, yeah, thank you, we can do telehealth, but because we have such limited resources, people are going outside of the state as an alternative and just doing telehealth with maybe a provider in California because their insurance accepts it. Yeah.
Sorry, right behind.
Would you kind of reflect on, is it mostly drug-related, instances that
Oh, I
you?
would say a very small percentage.
Very small?
Very small percentage, just because it's easy to look at something and kind of check that to it. But I think most of the crisis that we see is people who've gone through their lives suffering in silence and then finally getting to that day where it just gets too heavy. I would say very small percent of the people that I see is under the influence of anything, and usually they're just been like, I've been weathering the storm by myself, and even my partner doesn't know how close I am to killing myself, because it was that old lone wolf of I don't talk about it, pick myself up by my bootstraps mentality that was so toxic to so many of us, when we're really such a tribal animal that loves connection and loves that shared struggle. I mean, we learned about it in the military. We go there being like, I'm gonna be by myself, and next thing you know, you're with a stranger from Florida being like, is this my best friend? I'm so tired of being yelled at. So it's one of those things of I think if anything, what we see is people that are alone or that feel isolated or feel that nobody's there to really hear them or that nobody even cares. Maybe the drugs would help, I'm just joking.
Yeah.
But yeah, for the most part, people are sober and doing their best.
I'd already thought of that.
Appreciate you. I know, we would hang out, you're awesome, I appreciate you so much.
Programs in Oregon are producing the most effective social workers who can withstand the trauma of being a care provider too, that are given that balanced approach,
Oh, that's hard. I would say now, it all depends on the person.
we can turn off the camera if you wanna be honest.
No, well, no, 'cause I went to, my undergrad is through the American Military University, and then I went through Louisville for online. But to me, it has to do with where your passion is. Because there's some social workers where they wanna work on the macro, they wanna work on getting major policy pushed through, which to me is like if I'm in trouble, that's what they'll do to me. Cause that's Excel sheets and doing grants and working with politicians. I'm more of I wanna meet face to face. I like being in the crisis setting, and I like meeting with people because I think when you go to somebody who's in crisis, you're seeing the most rawest version of that human being, which I hope that I try to keep myself as being that way. It's it always reminds you of we're all one bad day away from needing that intervention, and it stays humbling and you stay attuned with your own hard days. I was in the back talking about this horrible thing I just went through the other day, and felt safe to where I almost started crying in the back of this room earlier, just because I have my wife and my awesome supervisor here, and I love these women so much, and I'm like, oh my God, I live such a good life. But it's because of the work I get to do that is always humbling. So if I'm gonna say about a program, I would say it's all about the practicum. It's all about where you wanna get your learned and lived experience. Cause we're always needing people, and I'm always encouraging people, if you wanna experience crisis, come to the Stabilization Center. like look into like, we have like a couple little shifts, and I'm always encouraging people, any age, any background, if you wanna get an eye-opening experience about who your need is, come to the Stabilization Center, because you're gonna see every socioeconomic, every race, every gender, everything. Guess what we all have in common? We all need people.
Yeah, and I was just gonna add that we have a really robust internship program at Deschutes County Behavioral Health, and we get, God, how many interns did we have last year? 3?
3.
Who came specifically and worked for the crisis team, which has been phenomenal. So that's where you get the experience to kind of figure out, is this what I want to do, or do I never ever want to do this again in my life?
Because they don't teach crisis.
Yeah.
Like, you learn crisis on the job. They teach like diagnosis, they teach that type of stuff. But when you get the experience of crisis, it's all about like, you learn when you're in the moment of like, is this something that I can feel at peace with, and something that I can kind of thrive in the chaos of like what it could be.
Great question.
Do you take volunteers, or do you need volunteers?
Oh, that's a really good question. I'm thinking really hard in my head right now if we've had any volunteers come. If that's something that people would be interested in, I could leave my email. We would have to go through a training process and all sorts of things, and I don't know what the capacity would look like, but that's definitely something that I would be willing to bring back to our leadership team if people are interested.
What is your peer-to-peer program? Are those paid people?
So
Peer
our,
support specialists, yes, they are paid.
Okay.
paid
so
staff.
but our peer is like what I always argue could be one of the hardest jobs there is.
Yeah.
Because picture this, like me, I'm a combat vet. I did over a year in Iraq, and one of the hardest things for me to meet with is vets and active, kind of like I don't wanna call it a flashback or something like that, but that's really heavy in that moment, whatever they individually went through. So I always I check in with my peers all the time, because in no other job do they ask you to be in your active trauma and do your work and to work in it. So it is to me one of the most admirable, selfless jobs there is. Because our people that meet with people out in the houseless community are mostly people that themselves been houseless, that are in recovery, that are working in their own stuff, and I'm just those people are just the most remarkable people to me, because they're putting their own triggers, their own stuff above and really showing up for people. Like I said, in that most raw emotion, which is beautiful. My case managers and peer support specialists are the most selfless people. They mean the world to me. We cannot do our job as a clinician without them. Because usually by the time that we show up, they have a relationship going, which just fills your heart. Oh, I'm sorry, I don't know who was first.
I have a question about the 911 dispatchers and how they're trained and to discern, what's violent or, how that process
So,
can really mess things up sometimes.
oh, it can, and luckily so what's great about the CAD system is that there's the dispatch of hey, we have an individual that's presenting disorganized out on a street yelling. So it comes in and they tag us, law enforcement, and EMTs in it. So immediately we go into the chat of being hey, do we have an identity? Do we know anything about the person? And sometimes yes, one of the 7-Eleven workers recognize them. This is who it is. Awesome. Okay, cool. We see that they have a violent background. We'll respond. Can we have law enforcement be a block away? So we start planning with them, or we'll be hey, if so, just stay in the area. We'll go meet with them and be safe. But sometimes it's they're in the back of 7-Eleven at 2 a.m. There's no lights, and we're okay, cool. Now I want law enforcement to be there with me, and I'm going to be very brave, 20 feet behind them. It's the best when there's a little bin PD officer this big, and I'll be right, you got this.
And they also have a screening decision-making tree that they have as well. That we did a lot of preparation, myself and my boss, we did a lot of preparation with 911, preparing for this, so that they had specific questions to ask, what to look for, so that they felt confident. We still we're still learning, we're still in that rollout phase where we're definitely, tweaking things here and there as needed. Yeah, excellent question.
It sounds like a really good system that should go.
Yeah,
Right.
I think we're doing great. I'm really proud of how far we've come in a really short period of time. It's actually pretty remarkable.
So about how many people have you on staff in total?
For CCRT or the entire stabilization center?
The stabilization.
The entire crisis team, including leadership and our program director, is 51.
Here.
Ford,
51.
51, 40. Yeah, we have, so that's everybody.
And it's like 24/7?
Mhm.
365, yep.
Yeah, I worked New Year's and Christmas, and it was just amazing. Because even though nobody came in, people would call and be like, oh, I didn't think anybody would be there. And spend 15 minutes over the phone with them of like, oh, the holidays are so sad. Like, yes, they suck, but this is when we get deals on vacations, so let's talk about Cabo. You know what I mean? And it was amazing, people would just need that little distraction, because sometimes we get stuck in here, and this is where we spend 90% of our time, and it needs to be a nice place to live. And sometimes people need reminded of like, oh yeah, I'm just beating myself up right now for no reason. Sorry.
How much
so
and how
sorry.
long is the follow-up of patients?
I'm so sorry,
How long is the follow-up on patients? How long?
That depends individual case by case basis, because sometimes, we'll even do a phone call the next day called the caring connection. So, and kind of like to also on your question earlier about dispatching, so we do have, in Bend city limits, a ride-along program where we have a therapist embedded with Bend PD that's on 4 days a week. And so if Bend PD gets a mental health call and they just happen to be on call, they can get, her name's Stephanie, she's a great clinician, and Stephanie will respond directly with a Bend PD officer. Because we really try to also have that available, because sometimes Bend PD will be on scene and will be like, oh yeah, like there's something else going on here. Like, and they can get somebody there a little bit quicker as well. That program's proved to be very fruitful.
Yeah, and so for the follow-up, we, as Josh mentioned, we have a caring connection, which is making sure the next day that someone on the crisis team makes a phone call to that person and kind of check in. We can provide an access appointment, which is an intake for behavioral health. We can provide case management. So we are really good at doing that within 24 to 48 hours. The other great thing is that if the person who comes up in crisis is already embedded in Deschutes County Behavioral Health, we can reach out directly to their team and be like, hey, so-and-so just came in, can you reach out to them today or get them on your schedule this week? We also, because it's a crisis situation, we have a period of time where we can reach out to outside providers to keep as under the crisis umbrella of care coordination where we don't have to follow HIPAA. So if I come in, Josh meets with me, I have a therapist in the community, he's really concerned about my safety, he doesn't need my permission that day or within like 24 to 48 hours is typically how we handle it, where he could call my therapist in the community and just say, hey, Rebecca came in today, I'm just really worried, can you make sure you reach out to her? So I consider all of that follow-up, right? Is that, I mean, we do it, I think, pretty quickly. I also want to be really honest that we're human and we miss people and people fall through the cracks. I wish that didn't happen, but it does. But I think overall considering, I think we do pretty good at following up with people. Did that answer your question?
Yes,
Yeah.
but of course it depends. I think there are many people that get help right away and then they fall back into situations where they get back into trouble.
Mm-hmm.
Oh, yeah. I mean, unfortunately, that's kind of the crisis work. I mean, we see, and we can only do so much. We can only help a person to a point where they're willing to be helped. We take it very seriously sending people involuntarily to the hospital. We don't do that unless we need to. And so if somebody's gonna continue to make decisions that are not healthy for them, we can only do so much. We see them repeatedly over years. Yeah.
I'm sorry, this young lady.
If someone were to call 911 for themselves or a client or a family member, could they, and would it be helpful to mention CCRT, like request it?
100%.
Okay.
Yeah.
We're from Silvernail and we write behavior plans, so we're also
Oh,
looking
cool.
to.
You're from where?
Silvernail Behavioral Services, it's fairly new
that's
in
awesome.
this area, and
Can I
so.
get your guys' information when we leave here?
Absolutely.
We hoard all that stuff, so I will have,
Okay,
yes.
we do too, yeah. But so we're always looking to update the protocols for our clients and the behavior plans that we write. We have a crisis section. So really interested, and I can talk to you later about the details of that, but so, okay, so that would be helpful to just
Absolutely.
right off the bat, so there's no tree going through the tree.
I will give you the number too, before I leave, that professionals can use to contact,
Oh, great.
just
Okay.
not, individual clients.
Okay, and then I
Yeah.
have another question. Are you able to respond to folks at the hospital?
Oh, we always do.
That's,
Okay.
yeah,
Yeah,
when,
the hospital, the jail, other county providers,
Okay.
detox, we respond everywhere, and we also do consultations for everybody, like
yes,
sorry, keep going.
I just wanna make one clear distinction.
Okay.
We only respond to the hospital when their staff is not available.
Yes.
So the mobile crisis team is the ED social work when they are not available. So typically it's after hours, typically. There are days when their person calls out sick, our team fills in and we go to the ED and meet with people as needed.
If so, sorry, one more thing on that. I probably have a bunch more questions, but so I'll just do one more for now. If someone is at the hospital and the team there is just not meeting the needs of the individual that's in crisis, can a family member or another team member of that person not from the hospital reach out to you to get additional services?
If they
Or is
wanna
that
leave the
not
hospital,
your-
yes, but we cannot
Leave the
go
hospital.
in as a secondary provider into the hospital if they have their staff available, cause it would be a conflict of interest.
Yeah, okay, yes.
Yeah.
The social
Great
worker.
question.
Okay.
That was the best answer.
Thank you.
That was so good. Like, if you knew how much was behind that, that was so good. Sorry.
So for people that are staying in a shelter that is not located in Bend, is there the possibility of transportation to the stabilization center?
So, yes and no. Deschutes County, we only work in Deschutes County. 6 months ago, I would have given you a different answer, but we're having some financial things that we need to be cognizant of because we were spending a lot of money on Uber rides. I'm gonna be totally honest. So, if there's a way for a person to get to the stabilization center, family, friend, shelter, that would be our preference. If they are in a mental health crisis that is not safe to themselves, they are possibly in a place where they could harm the community, disrupt the community. If we have staff available, we can come and get them. It depends on the time of day, it depends on our staffing availability. If they're safe to be in Uber, we used to use cabs, we can no longer use cabs. Because the Bend cab has actually turned to providing medical only transportation, so that's no longer an option for us, just FYI. So we can use Ubers, but we also need to be really careful with our Uber dollars right now.
To follow up on that, I would always, you can call
Always call us
non-emergency.
for us.
Yeah, you can call non-emergency and be like,
Mhm.
hey, so-and-so's in a mental health crisis, whether it be in Redmond or Lapine. We can send CCRT out there, so our clinician and case manager will go out there and they can bring them back with them. But that
If-
way they can assess them,
Yeah.
hopefully de-escalate them in the field. But also, like, if they can't de-escalate, those can ride to the stabilization center wherever they need to go. So like, I always like to encourage that, to be like, that way it's like, oh, just have CCRT.
If they're
fine.
if they're available.
If they're
I just
available.
wanna be careful that we can't always promise, we can't always say yes.
Totally.
So if they've used the stabilization center in the past,
Mhm.
then it would be possible to call staff there and maybe resolve the situation without needing transportation?
Yeah, or there's
Absolutely.
988, if you think the person just needs to talk to a clinician. Dude, I love 988, because it is like, mental health 911, and 988 is just quick, sorry, it was in my slides. Like, I'm glad that you asked that question, cause it brought it up, 988, anywhere in the continental US, is for people to talk to a clinician that could be in a mental health crisis, or somebody that's just feeling the need to talk. But that's always good, and if they start escalating, 988 will connect them to non-emergency to get them a ride. So we work with 988 a lot. Like they call bomb us all the time, where they'll be like, oh hey, 988, like what's going on? Hey, I'm here on the line with so-and-so, and the person's live on the line. You're like, set me up, like they get us every time. Thank you though, great question.
I think she was ahead of me.
Oh, who?
Over in the
I'm
back.
so sorry.
Way over here.
Over here.
No,
in the
I was
corner.
just curious if you work at all with any of the assisted living facilities when one of their
Yes,
residents
Mhm.
has a real issue, or if you're limited with that.
very much so. We are frequently called out to memory care facilities. It's challenging. It's really hard. We can only do so much. I think it's helpful when we can to keep the person in the environment.
I'm not
long as
thinking
they're
about
safe.
memory care, I'm thinking about other of the assisted living levels.
We
I think we respond to all of them.
We respond to
Yeah.
everyone, Regency, Juniper Canyon.
So do they
names are
call you, or
escaping me.
does the
They call us.
resident? Okay.
The
And
residents
the
do call us
resident.
too, yeah. Yeah, no, like all the above.
We had a year where one particular resident was calling us multiple times a day. We actually, this is a remarkable story. I just wanna say it really quick. We had an individual who was calling us daily, multiple times a day, and one of our case managers got heavily involved and had a beautiful idea and troubleshooted. They ended up buying this person an iPad. She never called us again. She was able to connect with her community. She was able to play games on the iPad. That's what she was seeking, right? She was, what Josh mentioned
Yeah.
earlier, that
Awesome.
loneliness, seeking that person-to-person contact. Yeah, I mean, it was remarkable.
So I just have two more questions. Sorry, everyone. So relative, your earlier statement about, it costing a lot of money
Yeah.
sometimes to transport
Yeah.
people. Are you guys hooked up with START and Sisters, and also CET has a group that delivers elderly here, there, and everywhere at any time? Are you hooked up with either of those?
I'm a bus stop right outside the Stabilization Center, so people are able to access us through the bus in Bend.
Yeah, but there's along with CET buses, they also have individuals that cater people to doctor
cool.
appointments or to, get groceries, like START does in Sisters.
I love that.
wonderful.
Yeah, so,
Thank you, yeah.
Thank you.
I got your email, I'll send you.
Perfect.
Yeah,
Great.
I'll send you information. My
Thank
other
you.
question and final question, just a minute, I have to pull it up. Is, having to do with the internships availability. So how is that communicated? Is that on your website? Is it available, and that's one part of the question. The other part of the question is it available to senior students or college students, or is there an age limitation?
So typically, it is a master's level program where
Okay.
people are going into the mental health field. We there's a whole process when you're in graduate school where you get connected to local resources. Vicki Boudinot, who is a supervisor at Deschutes County Behavioral Health for the adult outpatient team, she's the coordinator for it. So all the interest resumes go to her, and then we kind of disseminate throughout the county.
Okay, thank you.
You're welcome.
Sir.
I'm interested in probably an uncomfortable question for you, but we are all voters and live in the area and elect public officials. What message should we as voters, as we address public officials from time to time, carry your message to them? What would you like us to know about you?
We're in the
Tell
bottom
them
5 of
about
the
the
nation.
importance of it?
We're in the bottom 5 of the nation for mental health for the state of Oregon.
Okay, credibility issue is one
Yeah.
thing.
Wow.
And
You
what
can
about funding?
Google it. Yeah, like it's. What was that? I'm so sorry, sir.
What about funding? And that comes locally as well?
This is. Go ahead, Rebecca.
No, you're doing great.
Touche. I would say Oh my goodness, I have to be careful because one of the.
I understand. I
No,
don't
no,
wanna
no.
put you on the spot.
My beautiful wife sits on the Deschutes County Behavioral Health Advisory Board, so you gotta be careful with the enemy sitting in the back. I'm just joking, I love that woman. I would say that the need for accountability of the funds and funding and to make sure it's going to the right programs.
Okay.
Because like we can look at this data in ours and in 20 seconds show you guys about how important this program is, but yet we don't have solidified funding. But yet we can show you that we helped 12,000 Central Oregonians in the last 3 years, which is a huge population for Deschutes County, and that covers every background. And there's very few programs besides law enforcement and EMTs that can say that. So I think that like realizing that through COVID, we had a bunch of people move here thinking that all their problems would go away, and they realized that their problems followed them. I mean, us locals could have told them that. We were a mill town back in the day. And so we do our best to be like, yeah, we have the outdoors here, but you have to be willing to do your work. Us men, us amazing women, everybody in between, who they are, we gotta do our own work to be better citizens, and we need resources for that. And then we can truly support one another and get each other to that next day that we're all trying to get to. Thank you for the great question, sir.
So this kind of piggybacks on his question. It sounds like you're doing great work and you're needing to prove it so that you continue to get funding. Are law enforcement agencies who ordinarily respond to these things seeing a decrease in their efforts or resources going to things that are better suited for mental health professionals?
They're very happy.
Yes,
So
and
that will help you.
and we train them. So like we do trainings, I think a couple times a year at least, called CIT, Crisis Intervention Training, where many of us present topics, and also I'm an actor.
Really?
Like I said, I'm a diva. So like we get it, and my beautiful wife helps with that, and so we put the law enforcement responders through these high stressful interventions where they have to recognize that, like, oh, this isn't a crime, this is either mental health, we do substance abuse, there's a bunch of different scenarios that we put them through to give them a better experience of responding to it. And I must say that Ben and Redmond do a great job. And Sisters is pretty much an all-star team. There's a bunch of former Ben PD that had this great experience, and they've all moved down to Sisters. So every time I talk to Sisters PD, I'm like, okay, this is where the legends are. Like it's like Sisters is like got a great team down there.
When you said bottom 5, you mean the state of Oregon is in the
The
bottom
state of
5?
Oregon.
For overall funding.
Yeah, for all funding.
Against all the other states.
Yeah,
Right.
and my big thing is like, I'm really big about programs that work. And when I see how hard my peers and coworkers and the peer support specialists and all these people sacrifice every day, and the countless hours our supervisors actually put forward, like it's really remarkable how much of a fingerprint we're able to lay down with the limited resources and backing that we have.
If I can add to that comment, I'd like to share that I've brought clients and family members to the Stabilization Center, and it's always wonderful. You actually have assisted a family member of mine with autism. He was a teenager and he was struggling, and left there in a very great state with additional services, and fantastic. So thank you so much personally.
Thank you.
And the program I've seen just in the moment assistance is it's beautiful. So personal anecdote to add. So thank you.
Thank you. And I just saw the time, I'm so
Yeah,
sorry.
it's 1 o'clock and I want to respect their time. And that was a